The daily surge in cases that we are seeing in the national capital. Remember, it has been just about the past week that Delhi is daily recording 5,000 plus cases per day. The positivity rate that has gone up as well. The death rate, the death toll per day that has gone up as well. Now, the Delhi government has maintained that this has happened because of the festive season, and Delhi is looking at a third wave now of COVID-19. Keeping all of these developments in mind, there was a meeting that was called in by the union government, the union home secretary here having met with officials of the Delhi government to further take into account what more needs to be done. But as an assurance, post this meeting, what has been mentioned is that there is no shortage of beds. While the cases and the number of patients is going up, health infrastructure is well in pace. There are about 57% of the beds that are vacant. The Delhi government will concentrate with its efforts on target testing of sensitive zones. Our correspondent Ayushman is getting in further details on the big takeaways here of this meeting. Ayushman, on 2 points here, apart from the massive responsibility of people to maintain COVID-related behavior, about preparedness of health infrastructure on ground as well.
Yes, sir. In fact, that is what was the main part of the presentation which the Delhi government made to the MHA. In that, they significantly mentioned the part that they have got about 57% of the active bed facility that they have, it is vacant. But it is very important to mention here, sir, that as we are seeing the progression in the number of cases, the ICU facility is something which will bear the brunt of UP and Haryana, and also several patients are in need of it. The LNJP, which is the largest hospital, it is having 80% of these ICU beds occupied. There are private hospitals which are already started to struggle about that. The projection of VK Paul says that by the end of winters in the national capital, the case rise may go up to 15,000 per day. We have seen it nearing 6,000 in the national capital now. The Delhi government has given the picture to the Home Secretary that they are prepared with the bed facility. But if you see the ground situations here, that is something which is being talked about in the meeting. They are saying that somewhere COVID-appropriate behavior has to be followed, and for that reason only, the government needs to take the outreach program to people. The testing of RT-PCR needs to be increased. Winter is there, pollution is there, and both of these, along with the festival season, is actually adding to the worries of the Delhi government as well as the center. We have seen more than 5,000 cases for the 5 consecutive days in the national capital. Now, what is there in store? The Delhi government is clearly saying that people need to follow the COVID-appropriate behavior. That is something not taking place on ground. It is saying that it is doing aggressive tracing of contacts, which is actually improving the number of COVID cases. All said and done, sir, the ground situation is that people are gathering in large numbers and the COVID-appropriate behavior is not being followed. This is something is a worrisome factor which the health secretary has emphasized upon and has said that both the governments at the local level, the MCDs, and also the Union Territories, Aam Aadmi Party government need to work upon to somewhere break the chain of transmission of COVID.
That's right. Ayushman, important here to note, largely this is going to work out as a people's responsibility now as well, because the festive season is here to stay, at least for the coming 2 weeks. Thank you for getting us those details.